Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
ACE inhibitors. ACE inhibitors are actually the prodrugs. Exceptions of ACE inhibitors which are not prodrugs are actually captopril. All ACE inhibitors are prodrugs except captopril and lisinopril. These ACE inhibitors will inhibit the conversion of angiotensin converting enzyme. They will inhibit the angiotensin converting enzyme. Now, this angiotensin converting enzyme will normally convert angiotensin 1 to angiotensin 2. So, this conversion has been blocked by these angiotensin converting enzyme inhibitors. Now, pharmacokinetics of angiotensin converting enzyme inhibitors. These are well absorbed, and if you see the captopril absorption among all these ACE inhibitors, captopril absorption is interfered with the food. So we do not give the captopril with the food. Then moxipril, and we also have fosinopril, moxipril and fosinopril. So moxipril and fosinopril are mainly eliminated by the bile, and thus these are actually safer in renal failure. They are safer in renal failure. Then we have enalapril and lisinopril. Enalapril and lisinopril, these do not contain the SH group. So enalapril and lisinopril do not contain this SH group, whereas moxipril and fascinopril are eliminated by the bile and they have safer renal failure. So these drugs, ACE inhibitors, can be given. They can be given till the creatinine clearance will be the creatinine clearance. These can be given till the creatinine clearance will be around 3.5 milligrams per deciliter. Till this creatinine clearance of 3.5 milligrams per deciliter, we can give these drugs. Then we also have trandalopril and ramipril. This trandalopril and ramipril are actually, these will stabilize the plaque, and they will stabilize the plaque, and thus because they stabilize the plaque, they will block the atherogenic activity, thus they can cause anti-atherosclerotic activity. Thus, because of this anti-atherosclerotic activity, these trandalopril and ramipril are called as vessel selective drugs. Then, according to a study was done in these ACE inhibitors, that is called as HOPE study. According to this HOPE study, which is heart outcome prevention evaluation study, according to this heart outcome prevention evaluation study, according to this, there is reduced mortality by 22% is seen in this study. So according to this study, if you give ACE inhibitors, then that will reduce the mortality of a patient with hypertension by around 22%.
thank you and thank you for watching.